As a veteran, you may have unique healthcare needs. VA knows you want to live your healthiest life. One way to ensure you stay as healthy as possible is to get regular health screenings. Cervical cancer is a cancer of the cervix, a small canal that connects the uterus to the vagina. Cervical cancer is the fourth most common cancer among those whose birth sex is female. Some risk factors for cervical cancer can include, but are not limited to, smoking, multiple sexual partners, becoming sexually active at a young age, HIV weakened immune system, and HPV infection. The good news is that you can receive cervical cancer screening through your VA provider if you're enrolled in VA healthcare. With advances in cervical cancer screening, cancer can be identified in patients earlier than ever before. Just like you likely did in the military, you should continue getting regular cervical cancer screenings as part of your health screening. Screening for cervical cancer can help with early detection and may diagnose other treatable concerns. Cervical cancer is more curable with early detection, allowing you to take more control of your own health. Cervical cancer screenings are often referred to as HPV test or Pap test. While you're getting your cervical cancer screening test, talk to your provider about other testing that can be done at your visit, such as for sexually transmitted infections. If you are aged 21 through 29, you should have a Pap test at least once every 3 years. If you're 30 to 65, you have several options: a Pap test every 3 years, a test for HPV every 5 years, or a Pap and HPV test together every 5 years. Those who are 26 years or younger can get the HPV vaccine to reduce the risk of cervical cancer if they have not been vaccinated before or are uncertain about their vaccination history. Even if vaccinated, people with cervixes need to have regular cervical cancer screening and practice safe sex. The vaccine may not cover all HPV types associated with cervical cancer. For more information about the HPV vaccine, talk with your healthcare team. Pap and HPV tests are available through your VA healthcare provider. You do not need a referral for specialty care. We want to make sure you're as comfortable as possible during your exam. Please let us know if you prefer a specific gender for your provider. All of our women's health providers are trained in delivering pelvic exams and Pap smears with sensitivity to your unique needs. You will also be provided a medical chaperone. You can schedule a cervical cancer screening exam as you would any VA healthcare appointment, or you may talk with your provider at your next appointment. If your screening shows an abnormal result, VA will work with you to get the best follow-up care possible. Your provider will talk with you about any additional testing and/or treatments, or refer you to specialty care at VA or in the community. VA aims to make it simple for eligible veterans to navigate the process of receiving health care. If you have questions, need assistance, or need to enroll in VA healthcare, call the Women Veterans Call Center at 1-855-VA-WOMEN, 1-855-829-6636 to get information and to be connected with resources.